Mashonaland Central Province is one of the 8 rural provinces of Zimbabwe, and it is located in the northeastern side of the country. It borders with Mozambique to the northeast and Zambia to the northwest. It has 8 administrative districts, namely Bindura, Centenary, Guruve, Mazowe, Mbire, Mount Darren, Rushinga, and Shamva. It is an agro-based province coupled with various mineral deposits which are extracted through formal and informal mining. In the province, the Minister of Health and Childcare is in the process of implementing measures of reducing the number of people requiring treatment for neglected tropical diseases by 90% and reducing the disability-adjusted life years related to NTDs by 75%. Neglected tropical diseases, NTDs, are a diverse group of conditions caused by a variety of pathogens including viruses, bacteria, parasites, fungi, and toxins. They are associated with devastating health, social, and economic consequences. It is estimated that worldwide NTDs affect more than 1 billion people, while the number of people requiring NTD interventions, both preventive and curative, is 1.6 billion. The epidemiology of NTDs is complex and often related to environmental conditions. Many of them are vector-borne, have animal reservoirs, and are associated with complex life cycles. All these factors make their public health control challenging.
These neglected tropical diseases are a group of, currently with the WHO, they say there are 20 neglected tropical diseases, which are not being paid attention as far as funding is concerned.
Zimbabwe is endemic to 14 neglected tropical diseases, NTDs, including bilharzia, intestinal worms, elephantiasis, blinding trachoma, rabies, leprosy, sleeping sickness, anthrax, plague, snakebite and venoming, and many others. The top 4 NTDs in Zimbabwe being bilharzia, intestinal worms, elephantiasis, and blinding trachoma. NTDs disproportionately affect impoverished communities, with women and children being the most affected.
This program now is supposed to make sure that we address also the source of the disease, not just treating the children. And this involves making sure that we improve sanitation, because the children are getting bilharzia due to lack of sanitation, due to lack of toilets. We also need to control the vector, which keeps the bilharzia worms, which is the snails. So we also try to come up with strategies to control the snails, mostly with mollusciciding or chemicals that kill the snails.
Blinding trachoma is a neglected tropical disease and the world's leading infectious cause of blindness. It starts off as a bacterial infection similar to conjunctivitis, but if left untreated, it can cause scarring to the eyelid, pulling the eyelashes inward so that with every blink they scrape against the eye, which can lead to blindness. However, trachoma can be treated and even eliminated. One of the ways to treat the disease is through the use of antibiotics, which help to control further transmission.
Highly treatable and highly preventable. Prevention, I'll start with prevention. Prevention is so simple. We need to use hygiene, facial washing, cleanliness, and environmental prevention. That is, you need to deposit waste where they are supposed to. Because the other problem in the rural areas is, even if you've got a toilet at the homestead, children just defecate elsewhere in the open, and then flies will come and deposit the bacteria on surfaces which you can touch and then touch your eye. But the other one now is where you need to use antibiotic. And for the eye, there are specialists, even at the level of nurses, whom when the eye is reddened or there's inflammation, if you go to the clinic, they are supposed to be able to identify that these are early signs of trachoma. So it's treatable, highly treatable and highly preventable.
Gogo Kambera lives alone with her husband in Chevakadzi village in a lonely hut up in the valleys of the plush green outdoors. She is a subsistence farmer living off maize crop and domestic vegetables. She is a blinding trachoma patient who has lost most of her sight as she cannot afford the cost of her treatment.
Chipatara ndakamboenda kubhindura ndichitega ndinotariswa chimazisa. Saka ndaenda kuchipatara kwenzi 10 razika kunhingi 5 razodhindisa kadi uzonotariswa maziso. Ndabva ndaenda kuchipatara kuyoko ndokusvika zvikanzi dhokota haana kuuya nhasi mozoya svonde mangwana. Svonde mangwana chitatu futi handadzokera zvanzi dhokota adzokera kushashipake kuno munhu atosvika maziso. Ndabva ndazoenda futi zvikanzi mari yenyu yapera yanga ndanyoresa iye handinazobva ndaenda ipapo ndabva ndangogarawo ndashaya mari yacho.
Trachoma cannot be said is an elderly disease. It's only that the effects are now realized when you are old, if you don't take care of them during the early childhood or during the youthful age. This is a transmission which is caused by bacterial, and the bacterial transmission is so simple. It's just like what we were doing with the COVID, where you needed to wash your hands. Because flies do pick the bacteria, and then it can be on a surface. You touch the surface, and then when you rub your eyes, it means you transmit the bacteria to your eye. Or it could be sharing of towels. But now, during your youthful age, when you get the infection, you could sometimes resist the high rate of progression of the condition. And now in your old age, because of the eyebrows turning and rubbing on your eye, then it leads into constant rubbing. But during youthful age, sometimes we have got a treatment which we receive. Sometimes it reduces the level of that sensation which would cause the eyebrows to be rubbing on the cornea, on the eye.
The ministry in the recent past launched a mass drug administration campaign for the treatment of trachoma disease, which, if left untreated, causes blindness.
The program was effective because currently, among the neglected tropical diseases in Zimbabwe, trachoma is one of the diseases that we may reach elimination. When we talk about elimination, it's not that it won't be occurring among our population, but it won't be of public threat or public importance. Just because we have had several years of antibiotic or mass treatment, and we also had several years undergoing interventions where we have been doing the surgery, especially for those people whose eyebrows are now sort of rubbing on the cornea.
We also have teams that go out and examine people with problems with the eyes, because this is a disease which causes blinding. Yes. So our teams are mostly in the districts where we have got high prevalence of this disease. Again, Shamva Fishers, but we also have a district like Centenary. Mostly districts are in the valley.
Bajuensi Mfungidza was sleeping in a round hut right after supper. He was awakened by a prickly, tingly sensation on his right thigh. Little did he know it was a poisonous snake bite.
Ndakarara mumba. Saka ndikabva ndiruma pagumbo. Saka temzona ndikakotsira. Ndikabva ndapatika. Ndapatika ndikatanga kunzwa kuvaviwa pepa ndikutarisa pagumbo pacho so ndikuona pakubuda mvura so pakuita pachizvimba pachivava andi ndikangoti apa mweya meno kutonzwa pakuramba paita sei zvikutowedzera pakuramba paita sei pachivava dhero ndikabva ndatotadza kutoita sei, ndikabva ndatotadza kutorara kusvika kunze kwachena panozoni pakazondiudza kuti ichi inyoka, kutodza inyoka gumbo ranga ratoita sei, ranga ratozvimba, gumbo razvimba ndipo wakatozotarisa mupama imwe wakutoona nyoka itorimo zveshuwa ngeri kuseri kwematsaga mamune chibage chanchirimo. Nyoka yakatozouraiwawo indatobudawo but yazotorwa mafoto pandazoita sei, pandazoiratidzwa.
Poisonous snake bites kill about 90,000 people a year worldwide and leave a further 400,000 with lost limbs, blindness, and trauma. They particularly affect the very poor, such as barefoot farmers in rural areas. In Zimbabwe's Mashonaland Central Province, snake bites, especially in the rainy season, are common.
Over the past 10 years, the extent of having snake bites in the country increased enormously, where we have experienced even higher rate of deaths. But with the snake bites, unless you are bitten by a non-venomous snake, any snake bites reduces your economic value or your level of performance, either in school, in agriculture, and so forth. In Mashonaland Central, maybe because of the environment, with the mountains, the thick bushes, and so forth, and also people living natural lives. I don't want to say it's because of the climate change, but I think the weather has been changing, which means these reptiles, they come out of their hiding and now they get into conflict with the people. Or maybe because we've got something which is happening among where people live, like an increase in level of rodents. So it means they also come indoors looking for food. But the level of snake bites report in Mashonaland Central has been high. And people being left maimed, because once you've got the bite and it's a venomous snake, the wound will never heal.
There has been an upsurge of snake bites, and on average, as a district, we are having around maybe 2 snake bites per week, which are reported at the OPDs. And this week, we had a snake bite, and we actually lost a life due to snake bites.
Ndakarumwa 2019 ndichibva kundobvisa hembe panze manheru ndopandakarumwa nenyoka iyi ikatombondibatirire chigunwe ichocho chandaenda rumwa ndobva vandikasira kubva kuhaye kombi nguva iyoyo bva vandiendesa pai kuchipatara kushamba ndobva vazondibaya kuchipatara kuyi ndobva vazoti chiitai sei muchizobuda zvenyu ndakangorara zve1 day ndobva ndabudiswa mangwana.
Ndakarumwa guru rakapera nenyoka. Ndabuda panze paruwanze mapast 7 dzemanheru ndichida kunoteya mvura kuseri kwemarata payadhi ndopayakandirumira. Panguva yandakangorumwa nenyoka iyo ndakabva ndangonzopera simba, gumbo rangu rakabva ratochinja kuita green kusvikira kuita black patime yacho yandakarumwa iyoyo.
Tackling the problem is tricky for various reasons. For example, victims are often in remote areas and need treatment fast. Health workers cannot easily identify the culprit with certainty, and anti-venom treatments are expensive. The other reason is the traditional beliefs are responsible for most victims not seeking help from health facilities.
Chipatara ndakatadza kuya ndoda kuti pampasina mari yekuti ndikwanise kuya kuchipatara ungofungudza kuti ndinongopora ndiri kumba ikoko.
Ndakazobatsirwawo nevanhu vanoitawo zvemushonga-shongawo ndoparakazoparwa mazina acho chinzi nyoka yacho yanga iri poison.
Ndaingoramba chingotendera mishonga yechiwanhu iyoyo, mishonga yechiwanhu iyoyo handinozongokwanisa kuenda kuchipatara nekuda kwekushayikwa kwemari.
I think this is a simple observation of the communities, knowing that if I go to the health facility, there's no help which I will get, which is directly to the snake bite. Because when you go to the health facility, obviously you get some antibiotics, just because tetanus and the other thing about the snake, it can introduce certain other bacterial infection there. But the knowledge of the community that they need to go to a traditional, to seek traditional assistance first, in their sense, it could be helpful, because what they want is to have the fangs removed, and then they are given some traditional medicines to apply on the wound. Some of them, they say it works. But after a few years, when you look at the wound, you can see a depression occurring where the muscles are being destroyed, which means the poison is still there. I'm not really sure to what extent is the assistance from traditional. But traditional medicines, sometimes they do work. But as far as snake antivenom is concerned, I'm not really sure whether it is doing very good help, but it helps because the traditional, they do remove the fangs, and then later you go to the clinic where you get anti-tetanus, and then you get other conventional medicines for pain and so forth.
Sabu Kujeke of Chevakadzi village says after being bitten by snakes, most victims from his village tend to seek traditional healers instead of rushing to medical facilities. He, however, says he encourages them to go to the clinic as soon as they can.
Vazhinji munomu kuno vanobata-batawo zvemishonga yechivanhu kunyoka, asi munhu achiti kana anzarwa wanzi chipinda kuenda chipatara vanobatsirika mutowoyo, asi hatizosvika zviri kutaura kuna naye zvoka kuti munhu aenda aisiwa mishonga ayo chingida kungoti arumwa nonyoka wochienda kuchipatara.
Professor Mduluza Takafira believes further studies need to be conducted on how modern medicine can be enhanced by incorporating traditional healing techniques.
I think that strategy, the way the people, because we did some interviews and also observed how people are attending to the snake bites. We noticed that the strategy which they outlined, it is very helpful, where you go to remove the continued stimulation for inflammation, the fangs to be removed, and then maybe apply some traditional medicines, but they will need to go to the clinic for tetanus and others. But we still need to do a lot of research to come up with specific interventions to the snakes. Not biological alone. For myself, I'm an immunologist, so we are trying to see how best, especially all the medicines which have been said to be traditional herbs, which are said to be working against the snakes. We are evaluating them so that we can see how are they working. We milk some snakes and we get some venom. We culture with some cells to see how the herbs are working. But I think currently continued attendance by the traditional herbalist and then going to the clinic could be the best.
Tafadzwa Banda is a young lady from a settlement located at Shamba Gold Mine. She suffers from lymphatic filariasis, specifically elephantiasis, which is one of the 20 neglected tropical diseases that have been identified by the World Health Organization.
Mborangu rakazonyatsokura 2014, but raingoenda kura kwandaita sondokura kwadai kwaraita. Saka parizvo ndaiti ndakaenda kuchipatara ndongonopiwa amoxicillin parasite. Pandakazoenda rakubuda mvura ndopandakatanga kunzi inonzi elephantiasis.
With the lady, the lymphatic filariasis is a problem if people in the local people are not aware that the disease is existing. Because at the onset, the conditions are almost similar to the presentations in malaria. However, sometimes it could be helpful, but sometimes it may not be specific to lymphatic filariasis. So for her, the condition is now beyond reversal. Because once there is the upset of the deformity, which we call elephantiasis, there's no method which can reverse that condition except taking care of it, applying a lot of lotions, cleanliness so that there is no bacterial infection, and possibly trying to see that all the fluid that is produced is cleaned. But if she doesn't have those, it means there will be secondary infection, bacterial infection on those fluids, because it's human fluid which will come out. That condition also, you need to keep environmental surveillance, because if there's type of mosquitoes existing, even though once you've got the elephantiasis, they say the worms are no longer active, but they could be there. And if the vector is present, it can pick the worms and transmit it to the next person.
According to experts, elephantiasis is a chemotherapy preventable NTD of public health importance in Zimbabwe and many other countries. Infection occurs when elephantiasis parasites are transmitted to humans through mosquitoes. Infection is usually acquired in childhood and causes hidden damage to the lymphatic system. The painful and profoundly disfiguring visible manifestations of the disease, lymphedema elephantiasis and scrotal swelling, occur later in life and can lead to permanent disability.
Ndine mwana ane 7 years wanga ndakagara nepanapa kugara ndega naye. Mwana wangu inini ane condition yake handizoti inopera here. Ane one bhora hombe nediki, but diki racho kwada kutoziva kuti pane chinhu hunge wabata kana uchimugezesa, asi pamwe pacho ukatomubata anogona kutokudza kuti muri kundidzimbira. Ndakaenda kuchipatara pandanzi ndaende kuskani, sezvo ndanga ndisina mari ndakabva ndangogarawo. Wage wake wakambozama kuti ndomushandisira mushonga, but hapana chakachinja, kungoramba rakadaro condition yacho. Ininiwo pandakaenda kuchipatara ndakabva ndanzoenda kukaranda kwacho handinokwanisa kuenda nenheu ndanga ndisina mari.
Ranganai akatanga kungobva kwaakabva achibva kubhawa. Ndokusvika kumba kune mukadzi akabva ati nhasi kunzwa zvakanaka.
Mudumbu mangu makatanga kungorira zvekuti nanhasi ndatongone problem yekuti ndakatora nguva ndisina kudya, pandotanga kudya chinhu kuseni mudumbu mangu munotoita sound yekuti munotorira munhu ari pasaidi anotoita sei anotozvinzwa.
Paakati handisi kunzwa zvakanaka zvakaita sekunge munhu ari kungojoka zvake. Saka ndakazodaidzwa usiku ihwohwo achichema akarara pamumba mavo.
Saka pakabva ndakazvimba pamusoro panapa. Pazvimba pamusoro panapa pakaita rimwe bundo ranga rakakura kunge tennis ball. Ndizvo zvakandikonzeresa kuti ndizoenda kuchipatara mangwana acho kuseni. Ndaenda kuchipatara kuseni ndaichema zvimwe zvokuti zvakaoma. Saka ndasvika kuclinic uko ndakatombopiwa bed rest. Ndapiwa bed rest ndopandakazopiwa course yandakapiwa yematablets. But pakati chinhu cheche chakaita chadissolve zvokuti dumbu mangu ndakanzwa maregedzereka so ndobva ndatodzoka kumba bva ndagara. But ndagara manje ndakazoona pakutanga kudevelopa pachiwedzera kuita sei kuzvimba kusvika zvakundiafecta manje kuzasi kwangu.
Saka ndazotora mukadzi wacho ndikati ko chiri chikunyanya kurwadza murume wako paari kuramba asingade kutaura zviri kumurwadza. Ndokuti akazvimba kunhengo dzake ndo dzakazvimba dziri kurwadza.
Asikarudzi one side riri kukura, one side riri normal. Zvichisanganisira nekuzvimba futi padenga panapa. Zvokuti uchifamba unofanira kutopfeka pendi inenge iri tight. Ndakasapfeka pendi iri tight handikwanisa kutofamba distance kana kuti kilomita ndichitonzwa kuremerwa because size yekukura kuita ndingiri nacho unotonyatsoona kuti muitenge mune mvura like zvokuti wakabata kudai ukaribata kudai so unenge uchinzwa like mune imwe liquid inenge irimo but zvokuti iro ndingiri iri bhora racho remukati racho ukada kuti uri dzvanye rinorwadza risingatomboiti.
Saka toita sei zvikanzi achizotoita sendwati haya motikari but aenda kune mumwe muprofita chiti chivanhu. Tasvika kune muprofita uya akasvika ashandirwa tafungira kuti pamwe akaita sei akagadzirwa but hazvina kuchinja kuti apora. Ndibva tazogara tagara ndibva atanga futi kurwara futi achibva kubasa kwake kwaabva kwaanoita zvichijemeni mukati umu.
When you have got that condition of the scrotum swelling, it is, in a medical term, it's called hydrocele. Hydrocele is a condition found in men. It's still caused by the same parasite, the filarial worms. But for men, it goes to the testicles and then it causes accumulation of fluid. Fortunately enough for men, the condition is reversible. Surgery can be conducted and then the fluid can be taken out and the man can live a normal life. Unfortunately, for us, for the men and also in our communities, they don't know much about that condition being reversible. So most of the men, they live with the condition because they think it's a sexual transmitted thing or have been bewitched. Yet it's a simple condition which is caused by the filarial worm, which is transmitted by the vector mosquito. So it's fortunate for the men only with the filarial lymphatic filariasis. That is the only condition which is reversible. The rest, like when someone has got a swollen limb or swollen breast, that one is not reversible. It's a lifetime deformity. I've had 30 years of experience working on neglect tropical diseases since I did my first degree, and since then I've been working on neglect tropical diseases. We have seen that the problem with these diseases is not proper attention being given to the diseases or to the conditions. We have also observed that the communities themselves, they are not aware of how the diseases are contracted and what attention needs to be done. They say by chance you find yourself that I'm not feeling well, it could be that disease. So health education is required to be imparted to the communities that are living in those areas. And then there's also behavior change. Behavior change that is where you behave in conditions in a manner in which you come across the infection to take place. But for our governments, I would recommend that they need to work with the communities to have the behavior change, to also see that they have got a health education, and also to change the environment so that life is livable. And making them also aware is through health education that once you are feeling these conditions, can you please quickly go to your nearest health facility?